Good morning, and thank you for joining us. I want to start by acknowledging the tremendous support from our provider community. Over 2,300 providers in Pennsylvania want to administer COVID-19 vaccines. When the vaccine supply outpaces demand, they will all be helping to reach every person who wants vaccine. Right now, Pennsylvania's dedicated vaccine providers are making significant progress getting vaccine into the arms of residents in every corner of the state. Through March 17th, local vaccine providers have administered 3,840,896 doses of vaccine. 97% of first doses have been administered, and 66% of second doses have been administered. That means that nearly 2.5 million Pennsylvanians have received at least their first dose, and more than 1.3 people have received both doses. 1.3 million people have received both doses and are now fully vaccinated. As of today, CVS and Walgreens, our two federal pharmacy partners charged with vaccinating residents and staff of our long-term care facilities, have administered more than 404,000 doses of vaccine at more than 600 facilities. We are making progress. In fact, as of yesterday, the CDC ranked Pennsylvania number 2 in the nation for the number of doses administered per 100,000 residents over the past 7 days. That is proof that the pace of vaccination is accelerating here. But let me be clear, we have a very long and challenging road ahead of us. I can guarantee you that the team here at the Department of Health will not stop adapting and innovating our strategy until every single Pennsylvanian who wants it gets the vaccine. Those numbers show us where we are on the vaccine front. Now, I want to talk about where we are headed. It was just over a month ago that I announced the bold and aggressive plan to increase the pace of vaccinations and accountability to residents. Thankfully, our providers stepped up to the challenge, as evidenced by the numbers I just reviewed. Now that we are seeing some increases in our weekly allocation from the federal government, we're partnering with the providers who are best suited to achieve the goals of getting as many individuals vaccinated as quickly as possible. We surveyed all of the providers and mapped out an initial view of the provider network that will receive focused allocations over the next few weeks. We took into account geographic reach, access for residents, equity across demographics, throughput, and estimated demand. The ability to administer a high volume of first doses within the first 7 days of delivery, maintain equity across racial, ethnicity, and socioeconomic lines, other factors, as well as the ability to capture and report vaccine administration data within 24 hours, have all been taken into account. We have focused the network to narrow in on 200 to 300 vaccine providers designed to reach people with different needs and preferences. There's a mix of provider types, including hospitals, pharmacies, federally qualified health centers, and public health providers. These providers have received first doses this week and will continue to receive allocations over the coming weeks. They can be found now on our provider map, which Kira is going to tell you about in a minute. People in Phase 1A are encouraged to schedule their appointments with them. As supply continues to grow and we move towards President Biden's and Governor Wolf's May 1st goal of opening vaccine eligibility to everyone, the Department of Health will look to broaden our allocations to different providers. Eventually, those trusted local providers will be critical to reaching even more Pennsylvanians and building greater trust in the safety and efficacy of these life-saving vaccines. I want to be clear that we are working towards opening eligibility for everyone on May 1st. Eligibility does not mean that vaccinations will be immediately available. It will take time to get shots in the arms of everyone who wants a vaccine. Pennsylvania has no shortage of providers that are ready to administer the vaccine, but there is a shortage of vaccine. What I am outlining today is the infrastructure that will be ready to administer every drop of vaccine as quickly as we can get it from the federal government. For the next month or so, the 4 pillars of our vaccine infrastructure include providers receiving federal allocation, which there are 350 to 450 potential providers, including retail pharmacies, FQHCs, and potential FEMA-supported sites. Another pillar are our targeted vaccination clinics. These are the clinics announced by Governor Wolf and the Legislative COVID Task Force last week to use a portion of the Johnson & Johnson or Janssen vaccine to vaccinate law enforcement and corrections officers, grocery workers, firefighters, meat processing industry workers, and agricultural workers. We also have the focused provider network pillar, which is the group of 200 to 300 providers I previously mentioned. This group may include 3 to 5 provider mass vaccination sites. And we have our state-orchestrated mass vaccination sites. These will be high-throughput locations operated by PEMA and the Department of Health to address any remaining gaps in access and equity. Mobile vaccination opportunities will also be a part of our strategy to reach those hard-to-reach populations. These 4 pillars will be the infrastructure needed to make sure everyone eligible in Phase 1A is able to schedule an appointment by March 31st and then quickly move through Phases 1B and 1C. Throughout this process, we've had to make some tough choices. We've made those decisions based on sound science and data with the aim of protecting people from COVID-19 and saving lives. We know that times of crisis require leaders to recognize skill sets and capitalize on them. We also know that what the state brings to the table is the vaccine allocation from the Department of Health, the logistics expertise from the Pennsylvania Emergency Management Agency, or PEMA, and the National Guard to develop high-volume, sustainable vaccination clinics to efficiently and effectively get the most shots into arms at the quickest pace. At the same time, we recognize the strength and responsibility of local leaders who have their finger on the pulse of their own community. They are best situated to address the nuanced needs of their neighborhoods and hard-to-reach populations using true community-based solutions. We are already starting to see that local leadership in places like Lancaster, Lebanon, Pittsburgh, and the Pocono Raceway in Monroe County, where local leaders are building partnerships and leveraging their skill sets to have expanding vaccination opportunities. That's what residents need to see in every corner of the state. Now, I would like to introduce our Executive Deputy Secretary, Kira Kleinpeter, to discuss improvements to the online map of vaccine providers and additional transparency measures that we are taking. Thank you.
Good morning, and thank you so much, Acting Secretary Beam. The Pennsylvania Department of Health has continuously worked to provide information publicly that is the easiest to understand and provides the most information. As part of that goal, today, we are pleased to announce 2 updates to the data we have been producing. First, we are updating our vaccine provider map. Second, we are adding additional data sources to open data to be as transparent as possible. First, regarding the vaccine provider map, this update transfers the map from the previous platform to the Google Mapping platform. This transition will assist in providing accessibility to those who have struggled to view the map previously. The latest version allows you to download the data that informs the map. In addition, individuals can type in their address and find the vaccine providers closest to them. A location represented with a circle is a vaccine provider receiving an allocation of vaccine from the state. A location represented with a diamond is a location receiving vaccine from the federal government through the Retail Pharmacy Program. For each of the vaccine providers receiving state allocations, we have added the amount of first doses allocated to the provider that week. This first dose information indicates to the public which providers have been allocated first doses. For those providers that are receiving federal allocation, a link to our open data listing of the retail pharmacy partner data is available on the map. The map will only include those providers who have received vaccine during recent weeks, assisting the public as they work to schedule first dose appointments. It is also important to remember that doses does not equal appointments. Even if a provider has received an allocation of doses, the provider is the best source of information as to whether they have appointments available. This new map is easier to navigate using mobile devices and is more accessible for people with visual impairments. The changes being introduced today may be considered incremental improvements. However, this map platform allows more flexibility to develop more robust features that will help connect people to vaccine providers who have doses. We are already planning for additional features that include further information about which provider locations have appointments available, when providers have appointments scheduled, and further opportunities for the map to be viewed in different languages. The second update we wanted to provide today is that we have also posted even more data about the vaccine rollout online. We have been transparent with all vaccine allocated to the state. From day 1 of the vaccine rollout, we have provided detailed delivery information for every second dose within our control on one consolidated website. As of today, we are publishing several pieces of data to the Open Data Portal as we work to be as clear as possible about vaccine in Pennsylvania. The first piece of data is a file that shares which providers have received first doses of vaccine. We are really pleased to be able to provide this level of information online in this format, as we feel it will help residents see which vaccine providers are receiving vaccine each week and are able to schedule appointments for vaccination. We have been sending letters to the providers for several weeks now, letting them know whether or not they are receiving an allocation of first doses each week. Now, Pennsylvanians will have the same level of information. The second piece of data is a list of all vaccine providers who are receiving second dose allocations in a given week. As we have said repeatedly, if an individual received their first of a 2-dose vaccine from a particular provider, they should get their second dose there as well. Providing this data publicly increases transparency on which locations are receiving second doses and allows us to share this data publicly. A third file that is now available on Open Data is a file showing the retail pharmacy provider locations that are receiving vaccine in a given week. This file was available previously as a spreadsheet on our website. Adding it to the Open Data portal provides that information in a more flexible format. These allocations are coming directly from the federal government, and while they are outside of our control, we feel it is important to share which of these retail locations are receiving vaccine each week in order to help every Pennsylvanian who wants it to schedule an appointment. The fourth file shows all of the long-term care facilities that have a clinic scheduled in a given week as part of the federal pharmacy partnership. This information helps loved ones know when clinics are scheduled to vaccinate those in long-term care facilities. We have been publishing this file to our website previously. Starting this week, though, we are putting all of these pieces of information in one place on Open Data with our other vaccination information so people can easily find all data related to vaccinations in Pennsylvania. We will continue to provide the vaccine dashboard with a visual representation of how the vaccine process is moving forward. We believe this level of access to data is unprecedented, and we are moving in this direction as part of our commitment to vaccinate every Pennsylvanian who wants it. We are dedicated to our efforts to continue to work with the public, our vaccine providers, our legislative task force, and many other stakeholders to ensure the data we are showing is representative of the vaccine picture in Pennsylvania. Thank you. We're pleased to take your questions.
Thank you, Kira. We will now take questions. Thank you, Kira. We will now take questions in the order that reporters RSVP'd. Reporters will have the opportunity to ask one question, and if you have any follow-up, you can certainly reach out to our office after. First question will come from Deanna Durante from NBC 10. And Deanna, you have been asked to unmute.
Good morning, everyone. I'm hoping that you can hear me okay, and that my question today the answer won't get muted as it did earlier this week. Acting Secretary, I want to read to you an excerpt from the Disease Prevention and Control Law of 1955, where it says public health authorities are responsible for disease prevention and control in the Commonwealth. That combined with notes in your own order, especially from the one from February 12th about vaccine doses and providers, as well as Supreme Court rulings that also state that the governor and the public health authorities are in charge of administering rules and regulations around public health. Why would you tell the Collier counties yesterday in a Zoom when they made the request to get doses rather than a PEMA site that it was up to the legislative task force to make that decision and it was, quote, out of your control? As the acting secretary of the Pennsylvania Department of Health, isn't that precisely within your control?
Sure. Thank you so much for that question. I appreciate it. So one of the things that the legislative task force has been very transparent about is that we have really formed a bridge to bring consensus to a lot of our decision making. And the vaccine rollout has been specifically improved because of the work and the consensus building of the legislative task force. And so when working together and thinking about smart strategy to deploy in Pennsylvania with an opportunity like a one-shot Janssen vaccine, we built consensus around mass vaccination sites being able to really drive speed and volume in the areas of the state that might not necessarily have that capacity built. We capitalized on that, and we worked with the Southeast leadership to allow them to pick an actual geographic location that best suits their local leadership perspective And we hope that we have that continued cooperation and collaboration with the local leadership in making sure that that mass vaccination site is a success.
Next up will be Devine Courts from the Beaver County Times. Devine, you have been asked to unmute.
Hi, thank you for giving me the chance today. We've talked a lot about vaccine equity over the last few months, and I know one of the things that we've been talking about, instead of looking at where the vaccine's going, but looking at the number of arms that are going into. We're still seeing, particularly in mid-level, fourth-class county types, Monroe, Beaver, I apologize, places in the 150,000 range of 150 to 200,000 range of residents, we're still seeing really low vaccine rates, 15% of the population or less. What are we doing to increase the amount of people who are getting vaccinated when we have other counties that are near 40% vaccinated?
Thank you so much for that question. This is where we want to dedicate our efforts, is primarily looking at where there is the access to the vaccine and there might just not be the uptake. We think that might be more indicative of the vaccine hesitancy, which we've discussed previously. And to really overcome that, we're going to need our local leaders working with us to make sure that the safety and the efficacy of the vaccine is abundantly apparent in communities that may be able to be more receptive of that message coming from a local leader that they already had a familiar relationship with, or their clergy member, or even somebody in the community that they routinely engage with. The statewide average is 17% with the administration rate, and we are improving. And so we want to work to make sure where there are counties that are beneath that administration rate, we're doing everything we can to make sure that people that have the opportunity to actually get the vaccine are really availing themselves of it.
Next up will be Frank Krebs from CBS 21. Frank, you have been asked to unmute. All right, Frank, we will come back to you. Next up will be Jim Melwert from KYW News Radio. Jim, you have been asked to unmute.
Hey, let's see if we can nail some Jell-O to a wall here. I've asked this question before, but it seems like we've come full circle here. You just said that your mass vaccination clinics would help out areas that may not have the capability. But why are you cutting out the county health departments in southeastern PA that have been preparing this for years? Montgomery County could do 14,000 per day. Chester County could do 33,000 per week if they had the supply. It's a long way from Delaware County to Bucks County. Inequality will be increased, is what we're hearing from county leaders here, saying, give us the supply, let us decide how to put it out in our counties. Why are the southeastern PA county health departments being cut out of this?
So first, let me be abundantly clear. They are not being cut out of this at all. We continue to increase the vaccine allocations going to all of the collar counties week over week, as we previously discussed. We actually want them to be able to build upon those plans and capitalize on those plans, because local leaders know best how to reach the folks in their neighborhoods and their community-based efforts, which those counties really have been charged with. What we're offering as a state is to be able to come in with our scale, our ability to use that Janssen vaccine, that one-shot vaccine strategically, bringing in an asset of a mass vaccination site, serving the region, being able to really drive the volume and do it in a sustained way. We've talked about these sites being able to stay through the completion of the vaccine rollout and do it with off hours, do it with the supports that Pima can bring in from outside contractors, making sure that it is robust as possible and can reach high volume, high sustained throughput. That's what the state brings. What the county and local leadership has continued to do, and they've already delivered on it, is the localized efforts, and we want to see them flourish as well. And that is why the Pfizer and Moderna allocations are also purposefully increasing to make sure that they can be successful on their efforts. These two things should work in parallel, and we look forward to working with local leadership on that.
Next up will be Erin McCarthy from the Philadelphia Inquirer. Erin, you have been asked to unmute.
Hi, Allison. Going off of Jim's question, you've talked a lot today about the strength of local leadership and the fact that they have a finger on the pulse of the community in ways that the state does not. But when your office tells Southeastern Pennsylvania leaders to just pick a central location for everyone in the region and point the finger at them for, as your office says, bemoaning and belaboring the process, if the county leaders, as you say, have a pulse on their communities, why does the state care if the doses go to one clinic or 4 clinics? The counties are not asking for more doses, but to use the doses you have available for the region in multiple areas. What difference does it make to the state if there's multiple smaller sites that are sustainable or one larger one? And do you not share local leaders' concerns that a site that people have to drive possibly an hour or more to will worsen inequity?
Sure. So what we wanted to do from the very onset with the legislative task force is not look at the Janssen vaccine as just a product that would get flushed into our normal distribution channels. From the very first time that we made a decision on using that strategically for the educator and the child care workforce, we knew that to the extent that further Janssen vaccine would be coming to Pennsylvania, we needed to continue that strategic thinking. And for that reason, we were able to devise a twofold strategy. Yet again, working on those buckets of one, the meatpacking industry, the food processing industry, the law enforcement, the frontline workers that had really been, I think, heroic throughout this entire response. Make sure that one dose gets to them and gets into their arms as quickly as possible. On parallel, we wanted to make sure that the regional mass vaccination sites could effectively operate using, again, the asset that is the Janssen vaccine as quickly and as high throughput as possible. And doing that would allow us to reach folks for volume and for high throughput. I think we still have local leadership that should be really building upon their plans and creating that mass vac site has the intention of alleviating the volume pressure that they are feeling so they can narrow in on being successful on reaching their equity goals, which we likewise share with them and feel that they are best situated to actually deliver on.
Next will be Jamie Bittner from Fox 43. Jamie, you have been asked to unmute.
Thank you for holding this today. I have asked this question multiple times through email, and I still have not received a clear answer. Have any vaccine providers been cited by the state for giving to people outside of Phase 1A? And I'd also like to know, has the state caught up from that mishap where second doses were given out as first doses, and if so, when?
Sure. I'll start with your second question. So the complex smoothing process that we had to deploy has now been wrapped up. We are grateful for that. We are now moving forward with that predictable cadence of ordering and allocating that the providers in the provider network I mentioned can really rely upon to give them more of that predictability that they've been seeking from the start. I think, and I'm sorry, I blanked on the first question then. Can you repeat it?
Yes, my first question was, has any vaccine providers in the state been cited for giving to people outside of Phase 1A?
My apologies. So the enforcement aspect of it, our team has actively engaged by narrowly lowering vaccine allocation to certain providers where there has been noncompliance with our order broadly. I would have to check with the team specific to the Phase 1A and making sure that the compliance was actually happening with our staged phases of the vaccine rollout, and if the enforcement action has been taken specific to that aspect of the phase of the order.
Next is Taylor Telsheff from ABC 27. Taylor, you have been asked to unmute.
I was wondering, so will the Johnson & Johnson vaccine go to all of phase 1B? And then also, I did hear from someone in phase 1A, an elderly couple. Both the husband and wife are allergic to ingredients in the Moderna and the Pfizer. Johnson & Johnson is their only option. Is there any way for them to get the vaccine, because they already are eligible for it, but the ones that they can get, Moderna and Pfizer, they can't. So can they get the Johnson & Johnson, and will all of phase 1B be getting Johnson & Johnson?
So allow me to be clear on the Johnson & Johnson plan right now. So the way that we have used it to date is for the educators and the child care workers. But as of the end of this month, we are anticipated to be receiving a much higher allocation from the federal government. And there is a twofold strategy that we want to deploy. First, with some of the frontline workers that have been the law enforcement officers, the firefighters, those in the ag industry, and those that are grocery store workers, but then also those regional mass vaccination sites, which would be open to the 1A population. And so to your question about the specific couple, where there would be that regional site set up in whatever region of the state that they live in, they would be able to actually access that vaccine through one of those sites.
Next question will go to Sarah Bowden from WESA. Sarah, you have been asked to unmute.
Hi, no questions today, thanks.
Thank you. Next up will be Brett Schultes from WITF. Brett, you have been asked to unmute.
Hey there, thanks so much for the opportunity to ask a question today. I'm just trying to wrap my head more around the role of mass vaccination sites in the overall plan. I was at Lancaster, I guess that was a week and a half ago, and you know, people were literally brought to tears in front of me at the simplicity of the registration process there. And of course, they were the lucky ones who were able to get in really quickly. I'm trying to understand when you say state-run mass vaccination sites, is the plan to continue to increasing the dose allocations to more of these sites as they form and develop? And side question to that, are we still telling people, especially older people and people who are less skilled with, you know, the internet and email, are we still telling them that they're supposed to be relying mainly on the interactive map, or do we have better ways? Because that's been the central problem I've run into. Or are there better ways for them to simply register?
Sure. So we'll start with, I think, addressing the second question, which is really making sure that folks know the availability of the phone line, the 877 PA Health, which allows folks to actually use a phone line to access some of those same tools, including the map that we have online. As far as the provider strategy and the role that the mass vaccination clinics play in that, I'll just recap, because I know this is complex, but I'll recap where our provider pillars stand. So first, there are the providers that receive it directly from the federal government, which are the retail pharmacy partners, and some of the FQHCs and the PIMA site. Secondarily, there are those special industry-focused clinics that we've spoken about, which really are now the educators and the child care workers moving into some of those frontline workers. Third is our provider network, which is really where we had the ability to take what was a large group of providers receiving allocations of vaccine at different times and different amounts, reining it in, allowing it to be more narrow, more accountable, and those are the 200 to 300 that we discussed previously. Even with those three layers that we just talked about, our analysis still showed an opportunity to place strategically high throughput sites throughout the Commonwealth where they could really handle that sustained volume. That analysis was what supported much of the legislative task force and corroborated much of the legislative task force's action in saying the Janssen vaccine should be used to strategically make sure that we can capitalize where there is a lot of demand and set up the high volume sites. And so those will continue. Those are for a sustained amount of time. I think that probably is best answered for a discrete date by Director Padfield with PIMA and the team that has done a tremendous amount of work to make sure those sites can be successful. But we hope that's what can meet some of the high demand areas of the state where those first three pillars made great inroads, but still allowed for folks to be seeking more access to the vaccine.
Next up is Tim Stoldreher from One United Lancaster. Tim, you have been asked to unmute.
Thank you for taking my question. I'm wondering if you could contrast the situation in Lancaster with the situation in the southeast counties. You were kind enough to praise the Lancaster County operation today, but it sounds like you're at loggerheads with the southeast collar counties. Are you calling on them to kind of do a both and, where you set up this mass site, but you also want them to do something similar to what was done in Lancaster?
So I'll speak to the success of Lancaster. Lancaster was a pooling together of providers and local leadership there to really make sure that they identified the right space in a centralized location so that they could invest even existing supplies of the Pfizer and Moderna allocation that some of those providers were receiving to meet that high throughput in their community, and made it a regional site so that folks could access it from that region of the Commonwealth. The Southeast has a similar ask to them of, we now can come in as a state. We now finally have the volume of vaccine where we can offer the state to come in with that similar situated site, but even more of the asset being that one-shot vaccine, and drive a high-throughput, high-volume site in the Southeast. And we've worked, I think, with the local leadership to look for their deference on where the best location for that site would be. And so we hope to allow there to be a path forward where we can really have this site up and running as soon as that Janssen vaccine allocation comes our way, which we're looking at being the end of the month. So a lot of opportunity there. We want to work with the local leadership to capitalize on it.
The last question will go to Barbara Barr from WGAL. Barbara, you have been asked to unmute.
Thank you. Actually, just a quick question, Acting Secretary. You did mention what President Biden's goal of opening up appointments to everyone May 1st, and I wondered if you believe the state can do that. And do you have a date for opening it up to those in 1B?
Sure. So one of the things about the May 1st goal, it is aggressive, but we are going to work to be able to comply with it. Our main intention is that folks understand that really being able to avail themselves of the vaccine on May 1st doesn't necessarily mean a shot in the arm on May 1st. But what we want to have is the scheduling system and the infrastructure so that folks can be in line, know that they can actually have that appointment scheduled, and then have the peace of mind that they know that their appointment's coming. And so Pennsylvania is working diligently to deliver on the president's goal. For the Phase 1B transition, what is immediately before us right now is working through the allocations that we understand are coming at the end of this month to start in on some of those frontline workers. We hope to progress through the 1B category very soon after being able to deliver on that mission.